My name is Robert. I'm sure you can see the little bit of the joke, the pun. For some of you, it's probably not so funny because you live it, breathe it. That's it. You know, when you're out in public and you're having trouble hearing, you can only say what so many times before you just nod your head like you got it anyway. You know, you just finally say, okay, I got it. Or when they ask a question and you respond and you don't respond in kind and they kind of give you that puppy sideways look and go, what did you think I said? So to get started, we are Delta Hearing. This is ownership and former ownership. Deanna, who's at the table over there, is my boss, one of the owners, so I'll be on my best behavior today. Kind of, maybe, sort of. But I'll try anyway. If anybody has questions during it, because I kind of go through this fairly quickly, if anybody has questions, please stop and ask me. If you're like me, by the time it gets to question and answer time, I'll forget what the question was that I was supposed to ask. So we just kind of start over. We're going to talk about hearing loss, dementia, and cognitive decline and how they kind of interact today a little bit. Hey, common signs of hearing loss, and I'll try and get out of the way over here. But one of the biggest is people seem to be mumbling, and that's one of the things that we hear the most. There is nothing wrong with my hearing. People don't know how to talk today. They talk too fast. They mumble when they talk. My grandkids talk so fast I can't understand them. So that may be a sign that it might be hearing related, not just their talking related. It's harder to follow a conversation in meetings, restaurants, or noisy places. I'm sure you just noticed when you were eating that it's a little bit easier to hear and understand now. I'm mic'd up, we're in a quiet room, so it's a little bit easier to understand what I'm saying and making out the words. Yet add a little bit of background noise, get a few more people talking, it becomes a lot more difficult to be able to understand what we're saying. And then eventually we get to the point where we tend to limit our social activities because it's difficult to hear. My father-in-law was an example of that. When he hit 80, proud man, full head of hair, Armenian, ethnic to the core. We called him the mean Armenian, and he liked being the mean Armenian. But it was never his fault that he couldn't hear. And he just started to withdraw. He stopped going to his veterans meetings. He stopped going to the church meetings. They stopped going to other people's houses with my mother-in-law. And more importantly, they stopped having people over because he thought, why bother? I can't communicate. So kind of stuck a set of hearing aids in his ears one day, pulled him into his office and said, come on, Pops, you got some issues and let's go ahead. So I stuck a set of hearing aids in his ears, and he came out of his office, and the first thing he did, as the mean Armenian, was kind of blew up at everybody in the house. He thought they had played a joke on him. He was a big golf watcher. He had the golf tournament on TV. The TV was up at 100, couldn't go any louder. He didn't realize that he had put it up that high so that he could hear, and he came out and thought, ha, 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 somebody turned the TV up while I was in my office. As soon as I took the hearing aids out of his ears and he realized that that was the volume that he had set it at, he decided maybe he did have a time to get some hearing aids. So for the last 5 years that he was alive, it was kind of nice. My mother-in-law got her husband back. So we're going to talk a little bit about how we hear. Yeah, I'm going to play that. I'm going to talk a little bit about it instead of... Yeah, we're going to skip that, and I'll just talk about it a little bit. I'm going to take you back to 7th grade biology class 101. How many remember back to 7th grade? Oh, you even remember your teacher's name. All right. Okay, so we're going to talk a little bit how we hear. Well, sound travels in the form of sound waves. Can't see them, but you can feel them. If you've ever been in front of a speaker and had the bass playing and you can feel the bump, bump. If you've ever had one of those idiots pull up next to you in a car that's got the bass going and, the car is bouncing, you can feel your car vibrating. Well, that's just sound waves hitting your car. So when those sound waves come into the ear, they hit the eardrum, cause the eardrum to vibrate, and there's 3 teeny tiny bones attached to the back of the ear that vibrate in sequence. Anybody remember what those bones are called? Yep. Anvil, hammer, stapy. Yep. Stirrup. Yep. The hammer, anvil, and stirrup. The stapies. There's all kinds of names for it, but it's the hammer, anvil, and the stirrup are the names that we're familiar with from seventh grade. When those bones vibrate, they vibrate in sequence, and they send those vibrations into this little snail-looking thing. That is the cochlea of the ear, also known as the nerve of the ear. And inside the cochlea, there's multiple layers of liquid-filled chambers. And in those chambers are little hairs called cilia. Look like little sea anemones in there. Well, when those vibrations hit them, those little hairs move back and forth and translate those vibrations into electrical impulses. And it's those electrical impulses traveling up the auditory nerve into the brain that the brain understands as sound. And most of it's triggered by memory. So we've got a lot of moving parts. We go from acoustic energy to mechanical energy to electrical energy. Any questions on that so far? Because that electrical energy is going to come into play. Now, there's a number of common causes of hearing loss. The first one is presbycusis. That's the only age-related portion of hearing loss that's created by age. People tell me all the time, well, losing my hearing, I'm just getting old. Yep, I've got a 90-year-old mom. She's afflicted with Alzheimer's, doesn't know who I am, but she can hear the proverbial pin drop. So her hearing's immaculate, yet she still lost her mind. Heredity, some of you just got blessed with the genes that said, I can't hear. Mom and dad couldn't hear, grandma and grandpa couldn't hear, I can't hear. Chronic ear infections. Who had ear infections when they were kids? Okay, that can definitely play a role in hearing loss as we get older. Does a little bit of damage. And one of the other age-related factors that comes into hearing loss is kind of like arthritis. We injure ourselves when we're younger. Then as we get older, it starts to just get a little bit worse. That's what happens with some of the ear infections that we had when we were younger. Same with medical conditions. Anemia, high blood pressure, diabetes, stroke. There's a number of ailments that are ototoxic that will help diminish our ability to hear. Noise exposure. That's the biggest one. That's pretty obvious. A lot of the military guys in the office? 1, 2, see, 2, yep, I just see. Thank you for your service, guys. But exposure to loud noises, gunshots, gunfire, grenades going off, bombs in the distance. That's all going to have a factor in playing to diminish your ability to hear over time. And then side effects of some medications. Well, they've got a medication for everything. If you take a medication and you have a side effect, there's a medication to fix the side effect. If you have another side effect, let's give you another pill. Well, a lot of these medications that they're putting people on are ototoxic, and they're going to have an adverse effect on your hearing. So when we take a look at a combination of that, we've got age, we've got history in the family, we've got ear infections, medical conditions, noise exposure, and, again, medications. So the deck is kind of stacked against us as a whole, that most of us at some point or another are going to experience some kind of diminished hearing. So the latest estimate is that there's almost 38 million Americans that have some degree of hearing loss. Now, in this room, who's wearing hearing aids? Okay. How many people feel that they've got some sort of hearing loss? Okay, seeing some more hands go up. Okay. We're going to address that, why some of you that feel you might have loss aren't yet doing anything to help you. And maybe our talk today be a little bit of an impetus to say, maybe I need to go ahead and take a look at this. 25% of those aged 65 to 74 and 50% of people over the age of 75 have some sort of disabling hearing loss. Almost 30 million U.S. adults could benefit from wearing hearing aids, but only 30% have ever used them. Now, we all know somebody that's used them, said, oh, I don't wear them. They're sitting in the drawer. They're called ITD hearing aids, in the drawer hearing aids. They don't do anybody any good. You know, and hearing loss is kind of like, you know, maybe almost a little like conceit. You know, conceit's one of those really nasty diseases. It affects everybody but the person that has it. Well, hearing loss is a lot the same way. We may have difficulty hearing. We may have to turn the TV up a little bit. We might have to ask people to repeat themselves. But for all of you that have been around those folks, it's difficult to be on the receiving end of that communication as well. Frustrating to repeat yourself. Frustrating to have to talk a little bit louder. Those of you that have had positions, teaching, entertainment, directors of outdoor activities, to talk loud all the time is exhausting. Plus, it becomes part of your vernacular. I mean, my wife and I, when we go out because of her job and my job, add a bottle of wine, we start talking loud. We have to remind each other, inside voice. People say, why do you talk loud? Because I talk to people that can't hear all day long. I talk loud in my daily life. And on average, people wait about 10 years before they seek help. Why? Denial, vanity, cost, negativism. Well, hearing aids don't carry the stigma that they used to. You know, glasses used to carry a stigma. My daughter's 40. She needed help with new glasses. I said, well, sweetie, I'll get you some glasses, but why don't you get contacts? She said, Daddy, I don't want contacts. I look great in glasses. So she got 3 different kinds. Her glasses are not only effective, but they're fashionable. So when people actually come into our office and they say, I think I need hearing aids, typically they are 10 years beyond when they should have walked into the office and gotten help. You're nodding your head. You can relate to that? Yeah. Now, hearing loss is the 3rd largest public health issue in America. 40 million Americans are affected, and lifestyle in certain conditions can affect your hearing too. You know, that's a lot of folks in the U.S. that are affected. So, auditory deprivation is the inability of the brain to understand speech over time as a result of untreated hearing loss. It is the brain that is the true source of hearing and understanding. Once the ability to understand is lost, that ability can be difficult to regain. Wearing hearing instruments can assist the brain in retaining the ability to process and understand speech. Okay, that's a lot of verbiage to simply say we've got to keep our brain healthy. And as they're getting a little bit more into the ability to take live imaging and pictures, you've seen them probably on some of the science programs where they can show different parts of the brain that are firing up when they get certain types of stimuli. The more that they're learning about it, they realize that the hearing cortex of the brain is extremely important as far as communicating through the rest of the brain. If we don't get a complete signal, what happens is they can look and say, okay, the hearing cortex of the brain didn't quite fire up. And they do this by taking, and I'll just make it very simple, they take a half a dozen people, they put them all in a row. The first person has no hearing loss, normal hearing. Second person has moderate hearing loss. Third person has severe hearing loss. The fourth person was born deaf, but was granted the ability to hear through cochlear implants later on in life. One of the other people in the study was somebody that had the ability to hear, lost their hearing, and then was granted the ability to hear with cochlear implants. So they take all of these individuals and they fire the same stimulus at them and they see how the brain reacts. So they learn that when the hearing cortex of the brain doesn't fire up, it goes to another spot of the brain to try and get information. The first thing it does is goes to short-term memory and says, hey, what were we just talking about? Did he say cat or cap or hat? Well, we were talking about little fuzzy animals, so I'm going to plug cat into that spot. Smart individual, brain says, okay, let's go with context. Well, most of the time you're going to be right. Fuzzy animals, cat. But if you happen to be talking to somebody that just bought their new cap at the SPCA thrift store, and you start saying, well, what did you name him? You might get that sideways puppy dog look. What are you talking about? I don't name my hats. Oh, I thought you said cat. Okay? If short-term memory doesn't come up with the answer, then it goes to long-term memory. Okay, let's see what the memory can bring out of this. And if the long-term memory can't come up with the right answer, it goes to the imagination cortex and it just makes something up. All that happens in the fraction of a second. So hearing aids reduce the cognitive decline in older adults with self-reporting hearing loss, and that was back in 2015. Slides are a little outdated. There's some newer studies, one from John Hopkins University that just came out a couple of years ago, and even more recently a study out of Australia. The numbers that they came up with in these studies are absolutely frightening. One of the reports from Australia says that there's up to a 90% chance of increased dementia and cognitive decline with untreated hearing loss the more advanced your hearing loss becomes. So the moral to that story is catch it early. It's like anything else. If you had cancer, do you want them to catch it at the beginning or at the end? It's easier to fix the earlier that you catch it. It's easier to maintain. Subjects using hearing aids had increased scores for recalling words and working memory and selective attention tests and increased processing speed. Subjects also exhibited significant improvement in their cognitive function. One of the things is hearing instrument specialists that we have learned over the years, we kind of get an insight as to where people's cognitive abilities are as we're giving them a hearing test. Some people, we present a beep. As soon as that beep is presented, boop, they push that button. They're pretty quick. Change the frequency, present a beep, boop, they push the button. Then we have those folks where we present the same beep, and you can see it just takes a little bit of process. Did I hear a beep? Oh, I think I did. Press the button. Sometimes by the time that happens, I'm on my third or fourth beep, and I have to catch myself and slow down and say, whoa, I'm dealing with somebody that's just responding a little bit slower. That also lets me know that they've probably been dealing with hearing loss over a longer period of time. Any questions so far? Either I'm effective or boring, I'm not sure. Interesting, thank you. So when we talked about brain imaging, this is a good picture of it. On the left, brain function with hearing loss. You can notice that the frontal section and the lack of color, okay, the different brighter colors, the more cognitive activity. Hearing loss has varied potential impacts on such things as understanding short-term memory and balance. Now, on the right scan, notice a difference in brain activity. Kind of lights up like a Christmas tree. Corrected hearing loss increases the stimulus to the brain. There's that electric impulse that we were talking about. So I think given the choice, all of us would take that picture on the right versus picture on the left. The question is, how do we get there and how do we stay there? Well, we start with a hearing test and hearing aid fitting. You don't know what you don't know. How many folks have ever had a hearing test in here? Okay. Awesome. Awesome. That's good. Only a couple didn't raise their hand. Those are the ones that can hear everything, right? So when we have a moderate or mild or moderately severe hearing loss, it affects us in different ways. So when we take a look at this graph up here and we look at the pictures that are up there, a mild hearing loss, okay, anything below 25 decibels of loss, we start to lose some of these letters. Can you see? I don't know if it's real visible, but you can see FSTH. The softer sounds of speech are the first thing that we lose. Z, H. Now, when we get down here into the lower area, those are our vowel sounds. So a typical hearing loss has Good lows, I can hear, but poor highs, I can't understand. So a lot of the folks in this room, I can tell, are, I can hear, I just can't understand. There's that mumbling bit again. Or some of the people, I hear everything I want to hear, Rob. If I don't hear it, it's because I don't want to hear it. Moderately severe without hearing loss or without hearing aids, most of the hearing, most of the speech that you're going to hear is inaudible. And once you get to profound loss, the only way that you're going to get any semblance of hearing is with hearing aids. And sometimes when people wait long enough, all we can really do is get them to the point where we can help them with a little bit of directionality, let them know where the sound is coming from. But there is such a thing as permanent hearing loss, and that's ignoring it enough that it becomes part of your being, and even hearing aids aren't going to bring it back. Okay, so again, we're talking about cognitive decline. Over the course of 25 years, they did these long-term studies. And again, these numbers have been updated, and they're a little more frightening than even what this is going to show. But the risk of dementia with untreated hearing loss with normal hearing is pretty low. There's going to be other outside influences that aren't going to be caused by loss. But with a mild hearing loss, just a mild, you're up more than 2 times more likely to experience some sort of dementia or cognitive decline. With moderate hearing loss, that goes up to 3, and with severe, 5 times. The Australian study, as I said, uses percentages, and with severe hearing loss, it's 90% more likely. I mean, that's some pretty scary stuff. It all makes sense now. Oh, there's the cat again. Hearing's been linked to a variety of serious health conditions. People with a low frequency hearing loss are considered at risk for cardiovascular events, and people with mild hearing loss are 3 times more likely to have a history of falling. Any balance issues? Yeah. Our balance centers are in our ears. So you can see how it kind of goes hand in hand. You know, there again, the ankle bone's connected to the shin bone. Heart disease, dementia, diabetes, and depression, falling, kidney disease, mortality, and hospitalization. How many of you would have guessed that hearing loss could be associated with that type of ailments? Yep. So you've heard or read or seen something. For yourself or family members? Yeah. So, and they go hand in hand, and it's kind of like when you can correct this, then all of a sudden this gets a little bit better. You know, some things come with a price tag for repairing what we're looking at. When it comes to balance issues, bad back, bad hip, horrible, walked hunched over, went to the Good Feet store. Heard of the Good Feet store? Hear them advertised? Okay, little piece of plastic in the bottom of my shoes. I stand upright, makes me feel about 1 inch taller. At least my wife says it makes me a little taller because she's 5'11", so, you know, she's big. But it amazed me that this little tiny piece of plastic, and if you've not shopped them lately, $2,200 for a piece of plastic, okay, goes into the base of my shoes, takes away my hip pain, takes away my back pain. Best $2,200 I spent. Wish I had done it 10 years ago. Okay? So sometimes fixing ourselves just comes with a little bit of a cost that's involved with it. But the benefits far outweigh any money that we're going to spend. Okay, I didn't bring a quiz. Did you bring a quiz? We have no quiz. Okay. So you all passed. You all got 100% on the quiz. Okay.
Have questions, because we'll pass around the microphone if you do. Raise your hand if you have some questions, because I'll give you the microphone so everybody can hear you.
We've got one.
Okay.
Well, one of the biggest things.
You're on.
Okay, good. One of the things that I spent many of my years in the industries with headphones on. I worked for radios and television. and I walked around with headphones. And I noticed since I haven't been doing that lately, a lot like I used to, I lose it. It seems like I'm losing it, but it's from having headphones on, I think.
You mean as far as you're losing your hearing a little bit, or?
I'm having some of the difficulties you're showing here,
Okay.
but up until the last I don't know, 14, 15 years, when I really started getting involved with radios and televisions and doing interviews and things of that order, I started hearing it go, feel it go down.
Okay. You know, that's the fact that you're on top of that is really a good thing. The hearing test, coming in and putting on a set of headsets, grabbing that button and pushing that button and responding, really is the litmus test of what's going on. The hearing test shouldn't be frightening. It's not painful. It's simple. It's ABC. You can't pass. You can't fail. It doesn't matter. You either hear the beep or you don't. We can't trick you. You can't trick us. Okay? That's the first step. And then you'll get a baseline. So once you have a baseline, then it's a lot easier to go ahead and monitor it. Do you have a hearing test for maybe years ago that you ever had? Okay. So the time to get a baseline is as soon as possible. Then once we go ahead and take a look at that result of the test, we look at thousands of these every single year. We're pretty good at being able to assist you as far as coming up with a solution. A lot of people will leave my office and say, you know, Robert, I don't think I have a hearing loss. I just want to get a baseline, just want to find out what's going on. We'll go ahead and do a hearing test. And I'll look at some people and just say, wow, you should have been here 5 years ago. And they're in a little bit of denial. See, this hearing loss didn't happen overnight. If it happened overnight in the cases of some of these folks, they'd have been to the emergency room and thought they had a stroke. But it happens so gradually over every single year. Happens with our eyesight too. I see people wearing glasses. I have glasses. Well, glasses, it happens slow too. We don't wake up one day and can't read the menu. We just, gradually, what do? When we're in the restaurant? We start doing this, start doing this, start doing this. And pretty soon somebody at the table says, well, here, put these on. And we put on a set of cheaters and we go, oh my goodness, there's a menu. Where have these been all my life? Well, they've been on the same shelf in the store that we've gone by thousands of times. We just never accepted the fact that we might need them. So hearing's the same way. It happens so gradual. So get a test and get a baseline and kind of find out what's going on. Then we can go ahead and solve it. And that's kind of what this slide comes up with. This is not Grandpa's hearing aid anymore. Okay, we've evolved. So if you take a look at this big behind the ear hearing aid, that one, and this big old in the ear hearing aid, that's what we remember. Okay? Those were the hearing aids. Well, unless you need to, unless your hearing's really bad, those hearing aids aren't necessary anymore. We've got these teeny tiny little invisible in the canal hearing aids. We've got concealed in the canal hearing aids. And my favorite, we've got these mini rights and right hearing aids. All they have is a little wire that comes down along our temple. When I wear hearing aids to experiment with them, nobody ever knows that I have hearing aids on. They're invisible. You just can't see them. Even the in-the-ear hearing aids, we've gotten pretty good at concealing those in-the-ear hearing aids. Did you have a question?
Yeah, I did. When I originally enlisted into the service, I wanted to go into Air Force. And they gave me a hearing test and said, I'm sorry, you don't qualify. So I went to the Navy instead. But the problem that I had with the hearing test was my mind was telling me there might be a sound there, but there might not be a sound there. Did you really hear something or did you not hear something? I worked in casinos for 15 years. I know that I probably don't have any psyllium left in my ears at all because of that constant ding, ding, ding. And now I have severe tinnitus, and it drives me insane constantly because of the ringing. And I'm afraid to take a test because I don't know if it's going to be a true test or if I'm going to be imagining that I'm hearing things that I'm not hearing.
That's a really good point, really good question. Again, we've done so many of these tests that we know when we present the beep and we start to watch your responses, whether you're actually hearing the beep or not. That's just part of our training, and of course, that just comes with over time. So there are such things as false reads, but it's typically we'll present a tone and you'll hear it. And as we start to make that tone a little bit quieter and quieter, the brain remembers it. So it doesn't take but just an inkling of that for your brain to say, oh, I think I heard that beep. So the way that we test and with going up and down and what we do zero in and find the lowest thresholds at each one of those frequency points so that we really are good at what we do. Well, but we can tell that too. See, we can tell that too. Oh, I've had the guys come in, their wife drags them in by the ear, says, look, you're getting a hearing test because you need hearing aids. I can't stand listening to the TV and you don't answer me when I talk to you. And they'll come in and say, there's nothing wrong with me. And they'll sit there with that button, and I'm presenting the tones, and they won't hit the button because they think if I hit the button, I hear the tone. We can tell when they're faking it. That's when we turn it up a little bit, and we go, boop, make them jump a little bit and go, okay, you heard that one. And we go back and get back into the test. So, that is part of our training. Yes, sir. It's a little bit more than just amplification. When we do a hearing, when we program a hearing aid, we program it specifically to the individual loss, and it's on a per frequency basis. So kind of think of it as a giant graphic equalizer. And if your bass tones are good, we're going to leave the equalization of that bass at zero. You don't need anything if you're already hearing it. We're just going to fill in the gap. So amplification is a small part of it, but we're only amplifying your deficiencies. So when you see online, $299 set of hearing aids, this will cure it. They've got, some has-been actor that needs a paycheck saying, hey, this is what I wear, look at it. Those are typically amplifiers. And the amplifier itself, the reason that people have a problem with amplification is that's all it does is it's a linear amplification. So if your bass is good, you try and crank that to where you're bringing the highs up, but you're still going to bring that bass up. And so when you see people wearing an amplifier, or you see, I just remember my Opa. Opa had hearing aids. They were just glorified amplifiers. This was back in the 70s. But I could always see him trying to mess with it. And as the crowd changed at the family gatherings, some sounds were too loud, some sounds were too soft, and he was always messing with the volume, just trying to get it right. The only time that he got it perfect was whenever Oma was yelling at him, he would just go ahead and turn it all the way off, and then she would yell and say, Julius, do you have your hearing aids on? So, but, it was always a battle. So that's a good question. The modern hearing aids split all those frequencies up into little tiny components, and they address them one by one by one by one to create the benefit of having, all of it together. Okay. Yeah, just come on up to the table afterwards. We've got some info. But you got your hearing aids from the VA? So are you understanding pretty well with them? Do you? Yeah, another one. Oh, you're still mumbling. That's what it is. It may just be an adjustment. And I'm a huge fan of the VA. 15 years ago, the hearing aids from the VA were not good. VA wasn't getting the vets weren't getting the attention that they need, and I won't get into anything other than that. The vets weren't getting the attention that they need. And at the end of the Obama administration, he was forced to deal with the VA. And the VA now, the hearing aids that are provided by the VA are the best of the best of the best. They are top-notch, $7,500 hearing aids. One of our practices in Englewood, you're fortunate. You've got the VA clinic right up here on Bee Ridge, so it's right in your backyard. Take a look at the guys down in, South County, and they've either got to come all the way up to Bee Ridge or they've got to go all the way down to Cape Coral. As a result of that, at the Englewood clinic, I help program VA hearing aids for that particular area. One thing that I have found is that where the staff at the VA is fantastic, they are typically staffed by audiologists, and they just don't have the, for lack of a better word, the panache that we do, because we play with the technology of hearing aids every single day. So we know some of the ins and outs, kind of like taking a car to a mechanic that only knows how to plug your car into a computer and the computer tells them what's wrong. They're taking your car to a mechanic that can listen to it and go, oh, I know what's wrong with your car. So, you want to come to the specialist, and that's what we do. We play with that technology all day, every day. And as a result of that, and no worries, but as a result of that, we know some of the ins and outs, and we learn some of the ins and outs, little idiosyncrasies that help us tweak your hearing aids for your lifestyle and what you need them to do specifically. Yep.
I've got constant buzzing in my ears, and when I don't think of it, I don't hear it, but as soon as I say buzzing's gone, there it is.
There it is, because you thought about it. Tinnitus, tinnitus, tomato, they're both right. There's some good news and some bad news when it comes to that. Up until a couple of years ago, and this is how science evolves. I mean, we learn all the time, but they used to think that hearing loss and tinnitus were related. If you've got hearing loss, you've got tinnitus, or more, likely, if you've got ringing in your ears, you have hearing loss. Totally separate things right now. So they went from saying, okay, the tinnitus has to do with the collapsed cilia in your cochlea, nerve of the ear. No, what they've determined now is that the ringing in your ears is simply a dead spot on the brain. And not to say you're brain dead, but it is a dead spot on the brain, and the brain simply makes up a sound to fill that void. So some people hear crickets, some people hear a high-pitched buzz. What do you hear? Kind of like white noise on TV? Okay, when UHF comes on, or for all of this to remember UHF, So there's even a form of ringing in the ears called MES, which is musical ear syndrome, where people hear a song in their head. And one of my patients down in South County, when she got it, she actually went to her next door neighbor's house and knocked on the door and said, can you turn your radio down? And I said, lady, I don't have a radio on. And she said, can't you hear that? And they didn't hear anything. So she came into me, she was already a hearing aid patient. She came into me in a panic and she said, I'm hearing music in my head. That was my first exposure to MES. I've seen it about a half a dozen times now. One guy got so good at it, he could change the tune. Most of the time it comes manifested as some sort of March, John Philip Sousa type stuff, but it is that dead spot on the brain. So that's the bad news of it. The good news is we've learned a way to treat it with noise stimulation. What we do is we actually, if somebody needs hearing aids, we can pipe in certain frequencies, figure out where that ringing is. So if you're at 6,000 hertz, we're going to pipe in a little bit of a frequency, a little pink noise or white noise at that 6,000 hertz and mask it. While you're wearing the hearing aids, it's masked. The downside is take the hearing aids out, the ringing comes back. So it's a brain trick. It's not a cure, it's a brain trick. But we're making a little more headway on how to deal with it. So, anybody else have ringing in their ears? Yeah, that's you're hearing the ding ding from the slot machines. Oh, okay. That, yeah. Okay. Does it keep you awake at night? Yes. Okay. Have you tried any type of outside stimulation like white noise, a box fan, something like that?
I've tried many. I've tried the Mannheim steamroller. I've tried
Okay.
I've tried Anya.
The lady that had come to me my first case of MES, it was hers came on right after her husband had passed away. So she went to her primary care physician. He sent her to a psychiatrist. Her psychiatrist put her on a low dose I don't want to say Valium, but it was something along those lines. It was a low dose of something just to kind of mellow her out. And hers, they did that too. Yeah, you're just one of those unfortunate souls that until we get a little bit further into it, just,
I'd like to thank Delta Hearing and Robert.
oh, did I talk
And
too long?
If you want to come up here and learn a little more about Delta Hearing, feel free. But thank you very much, Robert. That was a very
All
good
right,
presentation.
so you're cutting me off, are you? Larry said you talked enough, Robert. Shut up.
What?
Yeah, uh-huh. So, and as you can tell, there still is selective hearing. There is a difference between hearing and listening. So for those of you that have spouses, sometimes hearing aids will cure the hearing problem. Listening requires a different tool. Yes, sir.
She gets so angry and said, "You need new hearing aids." I said, "I've had 5 different hearing aids, and they're all expensive, and they're all good. But you can't restore normal hearing with hearing aids."
But you're getting pretty close with these. Yeah, yeah. Uh-huh. He's getting pretty, he's
Treat her.
yeah. Treat her. Again, listening and hearing are two different things, Larry. Yes, sir.
When Larry had your people staying here, living here, got the greatest hearing care in the world.
Awesome. We're just down the road and we still provide that same level of care.
Larry did it.
Yeah. All right.
Thank you, everyone.
All right. Oh, you know, the sign that's up here that says it might just be wax. A lot of times people will come into our office and they'll say, and it's really two-sided coin, they'll say, I can hear just fine, but I just have wax. We look in their ears and it's crystal clear straight down to the, to the eardrum. But there are times that people come in our office and say, I think I've lost my hearing. And we go through and it's just simple wax. And enough wax in the ear will prohibit your ability to hear out of that ear. So, again, when in doubt, find out. You don't know what you don't know. So get educated about it. That's one of the biggest things that we're learning in today's society is if you want to get to the bottom of something, there's so much dis and misinformation out there, you have to learn yourself. So get educated on it.